First of all, welcome everybody to the Pima County Health Department Consumer Health and Food Safety kickoff event, which you're calling Back to Basics. So thank you for coming. Really appreciate you being here. My name is Rob Ringer. I will be facilitating the agenda today and help moderate some of the discussion in EB. We have an hour together, but if we need a little bit longer, I think most of the folks from what we call chefs, consumer health, so I use the acronym chefs, you know what I'm talking about. They're willing to stay a little bit longer, of course, and answer any questions that you have. Since we just have a small group with us today of operators, maybe you'd like to just introduce yourselves first, if you don't mind.
My name is Emmanuel Gabrielian, and I am the owner of Zimam's Ethiopian restaurant.
Thank you for coming.
I'm Matt. This is Jane. We're from Beyond Red.
Yeah, I think I met you out at the Desert Museum.
Oh yeah, absolutely.
Yeah,
For sure. That was fun.
I'm Gail. I'm with Three Parks here last year.
Yeah.
Thank you guys.
All right. Well, thank you for coming, and I think the rest are all Pima County employees and staff, so we have a small group. But we're hoping to build on this, and in the future, make this more of a regular event. And you can maybe give us some suggestions later as how we can work better to encourage you there, because what we're trying to do is not only have you learn from us, but us learn from you and you learn from each other. So the more operators that are here, the better. I thought I would just give you a little background of how we got here, 3-4 minutes, and then we're going to turn it over to the folks. We've got an agenda and different things that we can present to you. So for the last 4 or 5 years, I have been shadowing these wonderful people, learning from them what they do, and I've been talking to different operators like yourself. As you know, when I was out there on that inspection, I took a few moments to talk to you and get your perceptions of how things are, things are going. So I learned a lot during that 4 to 5 years. The first is how broad the mandate is, right, of chefs. I mean, they certainly have the restaurant owners, but they do that as, in your case, they have the temporary events that they have to come to, right? And there's quite a few of those, County Fair, the Desert Museum is an example of that. But they also have, mandates to run pool inspections. They have food carts, mobile units that they have to permit, as well as then doing the on-site inspections. Then, of course, they were saddled with the whole COVID enforcement piece from the proclamation and resolution, right? They had that as well. And so I think what I learned is that, they have to be available during the day, at night, on weekends, and I don't think they get enough appreciation for the work that they do. In fact, I can say that with certainty that they're underappreciated. But we're quite thankful that we have them, right? Because they help keep us safe. So I just want to thank them for all of them. The second thing I learned in talking with folks like yourself is that you actually really appreciate the education focus that they take with you. I mean, when they notice a violation, right, they don't have to sit down and educate. In fact, there's many counties and many other states that simply write the violation up and say, that's your problem, you deal with it. But they really are focused on the education, on helping you understand what the violation is, why it's a problem, and how to get a corrective action in place. And I know that the operators that I've spoken to really appreciate the fact that they do that, despite the fact that it takes a lot more time out of your day, and probably ends up putting them a little bit further behind in their day-to-day duties because of the time it's not doing that. On the upside, since you did appreciate the education focus, the operators were also asking, could we have a forum like this today, where again, you have an opportunity to come together, learn from each other, learn from the experts around issues of food safety. So that's kind of how we got here today. It's mostly a request from the operators themselves for a forum like this. And as I said earlier, we can find ways to grow this. And you have recommendations on how to do that, we'd love to hear from you. The folks you're going to hear from today are, many of them are supervisory positions. I spent 25 years at the university. I can say with certainty, chime in, is that most of the time leadership has no idea what's going on with the operation. Right? Your dean or whoever it is, they have no idea what's really going on. And so you're working in the trenches. But I think the unique feature of this group is that the people you're hearing from today, even though they may be in supervisory positions, they've all worked in the trenches. They've worked their way up and they understand exactly what's going on at the ground level. So they have a great deal of knowledge and experience that they can share. And it's based on practical day-to-day experiences. So the other thing is we are recording this today. So if anybody, is anybody with this being recorded? So the idea is to make it available, right? So others that couldn't attend to look at it and learn. So that's it, sort of the background. And I know we have an agenda here. We're going to be talking about what's new. We've got a case study that we think is going to be interesting for you to learn about, an outbreak that we had. We got a little bit of a need survey and then an opportunity for more discussion afterwards. So I'll introduce Lonnie Anderson. She's the division manager for chefs.
Okay, thank you, everybody. Welcome. We greatly appreciate your time, taking the time out of your day to join us and be here with us. I'm just going to grab this clicker. I will say, yes, we're definitely finding new ways to reach out and communicate and work with you guys and partnering. So I appreciate your time. It's very valuable, and we are grateful for you to be here today with our team. As Rock mentioned, I've been here for a long time, so I know some of you might have seen me or met me before. I am going to introduce in this moment our program managers, and the rest of the team is supervisory and environmental staff. I won't go through everybody just in the currents of time, but Danny Nikitas, he is our program manager for the food team. So anything food related, inspections, he does supervise that team. And Amanda Anderson, she is our program manager for plan review, any new permits, catering, limited food manufacturing. She's also oversees the aquatic, semi-public and public pools, that type of safety, and the vector control team. So right now it's mosquito season, preventing mosquitoes. What we're looking at is preventing West Nile virus. So we stay really busy across the board. And these are the other two key players in terms of those program areas. If you had some direct questions, they would be great to speak to for any questions related to that. I did ask that our supervisory team be here so that they can hear from you directly, be engaged, and be part of this process. So again, as Ross mentioned, we like to be involved and know what's going on and how we can help and make things better. So we definitely appreciate your time, and we're happy to have you here. If you haven't already signed in, there is a sign-in sheet. I believe Letitia probably brought it over to you. And Letitia Armandaria, she is our administrative supervisor. If you have any forms that you want to update contact information, there's some forms back there where you could add your information for contact. And also the survey at the end, you can provide it to Letitia on your way out. We also have a QR code on the survey, so you can do it on your phone as well. So there's some options there for that survey at the end, and just provide that to Letitia on your way out if you choose to do it while you're here. So this is just a quick agenda that's an overview of where we're going to go. Again, this is one of our first meetings. We want to find better ways to partner and communicate with you. There's so much information to get out there and give. We realized that a lot during the pandemic, and we're grateful to you for continuing to move during that piece along with us. So thank you for that hard work and transition during that time. We just want to definitely start to find a way that we can make our communication more effective to meet your needs. Part of this meeting would be to understand what those needs would be, so we can gauge some more educational materials, some educational courses, and have some breakout trainings that are different than this meeting. Like one more specific to people that want to do temp events, one more specific to someone that would want to pull a permit and start a business as a caterer or limited food. So we are looking to do some breakout meetings that are more specific to individual areas that we cover. So if you know people and maybe they don't own a restaurant, there's other things that we do and it might be useful. And so our contact list, you know, if you want to reference somebody to us, we can get them on a list to get those agenda items out. So at this point, we're just gonna talk about kind of what's new or what's going on now. We had our in-person food handlers class, and this is just a reoccurring announcement to everybody that it's still available. They are ongoing in person. They actually are happening here, right here in this room is where that course instruction occurs. We have our environmental health specialists that teach the course. It's a great opportunity for any employees of the business, manager level to the entry level to come in. The class is $30. You do have to pre-register, but in that class, they do go over food code requirements. They'll go over the inspection form and give you the view of what we're looking at and what safety measures we're evaluating during the inspection. So it is a great class to go to if you're able to come for that instruction. There is an exam at the end where they will receive certification once they pass class. It's not a required class at this time, but if you have an opportunity to send your staff, it's available, and there's some calendars and everything. A lot of these documents that are on this PowerPoint, there's some information there to the side, and outside of that, my card's there. If you need some additional information, just reach out and let us know.
Can I ask a question about that?
Sure.
Would that qualify for, like, I know that like a manager has to have a nationally certified, that would not qualify.
This
for
one
that.
does not.
That would be for.
Correct. This one does not, but it is definitely a great resource,
Yeah.
you know, for your key staff. And like I said, I think the big part about it that you can get out of it is they truly do go over the actual inspection form and what those violations mean, how to prevent them. So it's a great opportunity to engage or ask questions of the inspectors when they're out there. And so during the pandemic, you may have already seen this, and if you haven't, the county is sponsoring some free courses for employees of food establishments, and this is the Serve Safe Food Handlers course and exam. This also does not, this is what you were talking about here, count as the certified food protection manager, and that is a requirement currently for, you know, a management person in the facility. But this was a good way to allow some education still when we couldn't meet in person. Right? So the county is covering the cost of the course, and this is a great opportunity. We understand there's a lot of transition and turnover with employees. This is a good way to kind of get people basic knowledge of food safety. You can take the course on your own time. You can start and stop it. It's 30 days up until you have to complete the course. So it's just a good opportunity to provide education to your team. If you have existing employees, it would be a good refresher for them. So they can do it on their own time, and the other benefit is it's available in multiple languages. So you can contact our office by phone or email to request to have your team signed up for that as well. And even like those that have temp events, you know, if you're participating in temp events, this is a good way to get yourself or the people that you're having assist in your food service just basic education on good food safe handling practices. And so also, as we move forward, we are shifting to an electronic process for our plan review, the applications for plan review, and for temporary events. These are screenshots on our website that kind of show you how to get here. There's also a document on the side that has a QR code that will take you directly to those electronic applications. So this is new for us. We haven't really promoted it fully yet. It is on our website. You'll be aware of it there. We are still fine-tuning as we get feedback from the forms and the submittals. The next step would be to have the annual application electronic as well. So we're looking to do all of that in one fashion electronically as we move forward. Once we have it the way we know it should be, then we'll make a broader announcement of that. And then in addition is having the ability to pay payments online. We're moving slow, but we are moving in that direction. So those are some things that we look forward to moving forward with.
So in regards to that, so we participate in the No Trans Fats program and the gold discount on our, and the food bank, we take advantage of that program, and we renew every year.
Incentive program.
Yeah, and we've done that. Will we be able to continue to do that online, or do we just upload? Do we need to call? I mean, will that be part of this online process, or is that separate?
No, ideally, we would try to incorporate or catch that somehow during the process. So, yeah, and that's the reason we haven't really put it out there at a broad spectrum, because we're trying to fine tune these smaller pieces before we go large. But that's a great point for us to consider as we go forward with that piece. And the good thing about this process is you'd be able to do it from your phone. So somebody that needs to do a temporary event can start the process there on your phone, obviously on the computer. So we appreciate your patience in our transition, but hopefully the overall result will just be to make it a little bit easier for everyone. Okay, and so one of the bigger pieces of this meeting is about how we can connect with you and get the information out. Paper, because sometimes there's a challenge there in who we reach and how fast we reach you, right? So as I mentioned, our website, we do put the updates on there. You'll see some information on our website. We also have a newsletter that's being sent out electronically. So if you haven't received our newsletter yet, what happens in this moment is it's going to whatever email address we have on record. So if it's a corporate email address, it's going directly to that. If you're interested in receiving the newsletter directly, you can identify on the back sign-in sheet that you want access to your personal email address. Or if you know you have managers that you want to look at it, or supervisors or other staff, it's a good way to just get some great information. Safety handling practices, it's swimming season, safety around preventing illness in recreational waters. So there's a lot of information that goes into our newsletter. I am grateful of our team. They definitely get that content on there and available to everyone. The newsletter is also available on our website too. So if you went there, you can find it. But these are ways that we're looking to engage more and get information out there more readily available to the public. And so yes, if keeping your most current information in the system is a great way for us to get a hold of you. Another change we've been talking about for a little while would be the food code. So in 2020, the Arizona Department of Health Services adopted the FDA 2017 food code. And they also made changes to the Arizona Administrative Code. We have been in the process of moving in that direction. Again, with COVID mandates, it kind of got delayed in us moving forward, but we're looking at that now in terms of moving forward with it. So it's our goal to incorporate those changes in the Pima County Code. And the start of this meeting is to engage and have you there to provide some feedback or see what those changes might be and what we're looking to add into Pima County Code as well. And so some future meetings would be sent out regarding those updates and changes. And currently, everyone, we're currently on the 2013 code. So it would make sense for us to catch up. Oh, okay. So I am going to let Amanda Anderson take over. She's still going to be talking about some food code stuff, but again, this is 2013 food code.
Good afternoon. So I'm going to talk a little bit about our variance submittals. And so these are going to be for facilities that want to operate outside the food code. So a lot of times these are for built environments, can sometimes be for different food processes as well. So for those built environments, you're definitely going to need a variance if you're doing outdoor cooking. So there's lots of variations of that outdoor cooking, whether it's a grill, people want to do different types of kitchens outside. That's becoming more and more popular, of course, with our weather that's really nice in the winter and fall times. People also have a variation of that where they want to open up their dining areas with garage doors or other large windows. And so that would also require a variance because it does deviate from what the food code says about having those fixed walls that are easily cleanable. And then same with a lot of finishes inside buildings. People are getting very creative with the walls, the floors, the ceilings. They want big open concepts. So none of that aligns with the food code. And so there's a process called a variance where you can go through it to get those approved with different standard operating procedures, but we just make sure it's a safe environment for food. And so there are applications for these three main ones. They are actually live this week if your facilities are looking at doing any of those. And so they walk you through the steps very clearly of what information we would need from you. And then if you're looking at more specialized processes for your foods, so the charcuterie boards are getting very popular. So those meats on there are generally cured. Sometimes they're smoked depending on what you're getting. And so these are special processes. You're really working with the foods a lot. Use of food additives as well. They're not specifically addressed in the food code. Reduced oxygen packaging, live mollustic shellfish, sprouted seeds, juicing, and custom processing of animals. So these need a little closer attention to them. And we have a partnership with University of Arizona. There's a lab here that can partner with you. So they're really close if you need to get your food products tested for safety. They do it at a pretty minimal cost as well. And so they can do all sorts of testing for different bacteria that might grow out in your food and different shelf life tests. So that's great. It's a great resource right here in town. Very knowledgeable lab partners. They have worked with the FDA previously. So they've been working with food safety for a long time. And they do a lot of independent consultations in town as well. So we're excited that they're here and can offer these services so that when you do need a HACCP plan for anything you might be working on, they can assist and walk you through that too. Because we're just going to need that HACCP plan from you and we can work with you. But if you're submitting it and starting from scratch, it takes a lot, especially if you're a smaller business. It's going to take a lot of resources. So it's nice to have these available in town for you. And we're not going to verify anything. We're not going to say that the process is safe. We're going to need you to get that verified from an outside source. That's the scientist that can actually check the food. Does anybody have any questions on variances or HACCPs? Yes.
If, because we have the variance with our soup process.
Mhm.
So if we change anything or move any of the equipment, so maybe you move to the facility, would we have to, I mean, if we change the equipment or similar equipment, we would still have to, do we just change the verbiage on it or do we need to include that and just reach out to you guys?
Yeah, go ahead and reach out to us because we're really looking at this process. We sent all of our staff through a specialized process course with the FDA. So we're getting a lot more education and information about it. So we want to work with you guys because ultimately we need to keep your customers safe. And I know that's your goal as well. So yes, go ahead, you can reach out to me and we can look at that and look at your plan that you have submitted and make it work. Yeah, because that's ultimately all of this is about the safety of the customers.
Thank you. The reason we chose to include these in this presentation is as our team moves forward and we see this in the field, existing operators that might have been doing something for quite a while may not know they even fall in that category. So we wanted to kind of highlight that now, letting people know so they're not shocked or concerned or upset why we're asking about this process now. So that was part of the reason we wanted to focus here too.
And then I'll go ahead and hand it over to Ceci and she can go ahead and discuss our risk factors study.
And Ceci is one of our environmental health supervisors on the training team.
Good afternoon, everyone. So I'll be talking about the risk factor research study that Consumer Health and Food Safety will start or has started. This is in conjunction with the Food and Drug Administration. And this is to assess the 5 CDC risk factors across various segments of the retail food industry. And the study will take place starting this year up to 2024. So the 5 risk factors that we are going to be assessing are what are identified by the CDC as the major contributing factors to foodborne illness. And those include improper cooking temperatures, improper hot and cold holding temperatures, poor employee health and hygiene, dirty and or contaminated utensils and equipment, and food from unsafe sources. So the goal of the study is to identify the risk factors that are most in need of priority attention so we can develop intervention strategies to help assist our food establishments and operators to improve their food safety systems in order to reduce the occurrence of foodborne illness in our community. Your facility may be randomly selected to participate in the free non-regulatory inspection. All the facilities are randomized, so it's not that we choose a particular facility, they're put in through a randomizer. And this is just a notification if you see us visiting your facility, it's one of the supervisors that will be conducting the data collection. We leave a letter with you notifying you of why we're there for. And it's a non-regulatory inspection, so this does not count as a routine inspection at this time. It's more like a free consultation. If there's any items that need to be corrected, we'll work with you to have that immediate corrective action to protect the public and remediate any imminent health hazard that might be present. So we appreciate your willingness to cooperate with us in pursuing this task. It's going to be a lengthy task, but we're excited to develop those intervention strategies based on the findings that we get from the study. You guys have any questions?
Will you be notified
Well, it'll just be like a routine will appear there on site, because the point of the data collection is for the randomness to truly get a grasp of what the operations are on a daily basis. It will be like a regular routine where it's not scheduled. But we will leave a notice of a data collection letter with the operators, so they can pass that along to corporate or to upper management. And we will also ask for an email so we can send that electronically as well.
Are they really declining
Yes,
participation in this?
yes.
But if we were to decline, it would have to be whoever is at the score.
Correct.
Because I think we've done this in the past, but I think that they asked us ahead of time if we wanted to participate.
And so we've also done the standardization piece. Right? Some of our visits might be there for uniform inspection standards. So the inspectors will be trained on what to assess across the board. So we've done different types of interactions. And
Sure,
I'm sure you've
sure.
been part of our
Oh, yeah.
standardization. Yeah. And so even that's not regulated in terms of you're getting a score on those inspections. Honestly, to me, I feel like it's more of a free training for your team.
Yeah, no, it's been helpful.
So, yeah, we were doing a lot of different things. That piece is so that we can help ensure that our inspectors are assessing in the same manner. So we're gonna continue with that, and that's different than this. This feedback will go directly to the FDA as well, and so it helps them develop what goes to the group, what else, so there's different things behind this study, so they can decline, and some people may be afraid to decline. Here, I think that was the point of us putting it here, so people feel more comfortable to just, to engage and be part of that process.
And we will be announcing this also in our upcoming social media pages and newsletters. So our operators are aware that this is happening. We did start last month and we had success. All the operators have been very happy to receive us because they do take it as a free consultation and getting feedback on their current food systems. And that way they can have an improved routine inspection that will be rated or will be counted as a regulatory inspection. The space to Rocio, Lauren, she'll be presenting on foodborne illness outbreak in Pima County.
Just 1 second. Are there any other questions right now for Cecia, Bonnie, or Amanda? Here so far?
Okay, so we had a couple of outbreaks recently in Pima County. I'm just going to go over some foodborne illness outbreaks in the United States. Every year they affect about 1 in 6 individuals. It causes more deaths than deaths from fire. So it's a pretty significant problem just in the United States alone. And we do have certain populations that are more susceptible to foodborne illness, and definitely more susceptible to the consequences. So while some people might eat something that might just upset their stomach, that could result in the loss of a fetus for a pregnant woman, and it has different effects for different people depending on their levels of health, which is why we just want to make sure that we're addressing all of the populations we could potentially be serving. So specifically to Pima County, we had 2 major foodborne illness outbreaks just in the last year. They were at 2 very different facilities. The first facility, they had a salmonella issue in their kitchen, and that was a reoccurring outbreak for more than a year. That ultimately ended up affecting about 12 people that were identified through some lab testing that was done. And although ultimately the state estimates that it affected around 100 people. But just the 12 people that were sick enough to go to the hospital and get those samples submitted to a lab. So we know for sure at least 12 people. For facility B, we had, they were using an unlicensed catering service. So this was a short outbreak that had to do with Staphylococcus aureus enterotoxin. So that just spanned the time frame of 24 hours, but ultimately, out of the 99 people that ate the food, about half of them became very sick and required immediate medical attention. Two very different situations with different serious outcomes, but both affected the public in Pima County. So going back to those 5 broad categories that the CDC has identified for preventing foodborne illness, we're just reiterating those same hot and cold holding temperatures, the cooking temperatures, contaminated equipment, poor employee health and hygiene, and the food from unsafe sources. And our 2 different facilities, the one on the left, that was facility A. You can see the 3 categories. Out of those 5, we observed that they did have contaminated equipment, poor employee health and hygiene, and then hot and cold holding temperature issues. And then there are some examples of each observation that we made during the routine inspection. So these really are issues that pop up during routine inspections, and they're preventable with things like active managerial control. For facility B with the staff outbreak, they had cold holding, improper use of the hand washing sink, and you can see with both no written employee health policy, and then unique to theirs was the food from unsafe sources because they had prepared that at an unlicensed facility. The site was a catered feeding site, but where the food came from ultimately wasn't a facility that was regulated by us. So there was a chance that we could have intervened if they had used one of the facilities that we regularly inspect. So as part of the foodborne illness investigation, depending on what type of investigation we're doing, we'll do some environmental sampling. That takes the form of us doing swabs at your facility. If that issue arises, then we need to do that. For facility B, we took food samples and submitted that to the lab. And we use the Arizona Department of Health Services state lab to get this testing done so that we can keep our constituents safe. So it's we work with the state to get these situations resolved, and ultimately we work with the operators. I guess the bottom line is that foodborne illness does impact businesses. Ultimately, let's see, for facility A, when we did the environmental sampling, we had 44% of the surfaces that we tested that were contaminated with salmonella. These are surfaces that they worked with every day. So all the food that they had prepared during that time frame, the operator agreed to discard, just because there was no way to know it was safe with that level of contamination. That there was multiple closures, multiple remediations, and ultimately the owner estimates that it cost him about $80,000 in lost profits. There's a risk of media exposure, damaged reputation. I know for the second facility, a lot of the people, they were all in one room and they were all being triaged, and everybody wanted to know what had happened to them. So we needed to restore the trust in the catered feeding site because the clients were uncomfortable eating the food that was provided. The bottom line is that these things are preventable. As long as you're addressing foodborne illness risk factors through active managerial control, things like having food from unsafe sources, we shouldn't have to have that as an issue. Discarding unsafe equipment that's no longer smooth and easily cleanable, that was ultimately a contributing factor in one of the outbreaks. If you're not working at a facility that's licensed, you don't know what their hand washing situations are like. And these are all good preventative measures that will help stop foodborne illness outbreaks. So we really want to work together during any site visits, including routine inspections, to get those foodborne illness risk factors addressed. And ultimately, both facilities were very happy with the resolution. One of them did take a little bit longer and a lot more resources, but we helped them get to that point where the situation was resolved and they could ultimately safely reopen. Does anyone have any questions? We worked with our epidemiology division here at the health department as well, because the outbreak for the first facility involved identifying these cases through lab tests at first, so we didn't know that it was coming from Pima County originally. But besides, just outside of our division, we just worked with the state, yeah.
So you have a lot of resources that you can bring to bear to help problem solve these things.
Yes.
For your community to know. You also mentioned active managerial control. Some of those things.
So the main thing is that you're knowing whether or not your hand sinks have soap, paper towels, and hot water. You have a person in charge that is a certified food protection manager, and they're actually there watching employees, verifying that they're doing what they need to do. We had to increase active managerial control at both facilities, but definitely for facility A, the long-term strategy was to implement a type of risk control plan to prevent these things from happening again. So they actually watched their employees to make sure they were washing their hands for the required amount of time. And it includes testing your warewashing machine, because that was also a major contributing factor, is proper sanitization of the equipment. So if your staff doesn't know how to verify that the equipment's working properly, educating them and making sure that they're doing it at a frequency that is at least making sure that when you wash, rinse, and sanitize, the sanitizer is at the right level. And however frequently the machine or the manufacturer recommends is kind of what we're looking for, but some places opt to do it on a daily basis. So it's just being out there, watching what your staff is doing and making sure that everyone knows what they're supposed to be doing and that they're actually doing it. And if you have any questions, these are all the people that were involved in these two outbreaks. So you can definitely email them on ways to reduce or eliminate foodborne illness, at least in your facility. Thank you.
Thank you, Lauren. So you just heard from Lauren, and so I have the pleasure to let you all know that she did win an award. We nominated her for the Jacob Joseph Corby Achievement Award through the Association of Food and Drug Officials. And so that's a national award throughout the whole country. That's anyone in their first 10 years of regulatory field work can be nominated for. And so she won out of everyone that was nominated throughout the whole country. So we're very excited. And so she went to that Association of Food and Drug Officials award ceremony, and actually was in Phoenix this year, so it was really convenient that it was close by. So she got to go up there and enjoy that for her hard work. And Rocio worked with her a lot this year as well on all of our foodborne illness outbreaks. So she was nominated as well for that. And they both presented at the National Environmental Health Annual Education Conference. So we are really getting out there and nationally recognized for the work that our staff is doing and the communities that we serve and the communities that are able to work with us. So it's really exciting that it's being recognized at a national scale. So they both presented there. And then we also had Lonnie Anderson and Vanessa Zarate. They participated in the National Environmental Health Leadership Academy, and they graduated from that. And they presented to that cohort as well with projects that they're going to be implementing over the next year here to just improve our program. And then we also had a presenter, Anna Lopez Francisco. She was also on our foodborne illness team, and she presented at the National Association of City and County Health Officials Annual Conference. And she might actually be there.
I think
It's next week. So it's coming up. So there's a lot of excitement. A lot of staff is really doing an excellent job. And not only are they doing an excellent job for our community, but Vanessa used to be a trainer, so she was training all of our new staff. Anna and Rocio are currently trainers. So they're just inspiring new staff that come on to really do the same thing for our community. So it's very exciting.
I'm very proud. We're very lucky to have you.
Thank you. Thank you all. We definitely tried not to make it too long, but just give you the highlights of what's been going on. The reason we chose to put the foodborne illness pieces in is because it's been more of a reality for us recently, right? A lot of people are getting sick for many reasons, but now more doctors are checking, like, what is the reason? What is the real reason you're sick? And so the lab confirmations, sampling of foods, and so we've been on a lot of environmental assessments for many different locations, more increasingly over the last year or two. So that was the reason we wanted to highlight the importance of partnering, getting the information that you need to help your facility create better procedures or training, or how can we partner with you and make sure as we move forward, we prevent those types of issues from happening. You know, I've worked with the county for over 15 years. This is the first time we really had those true confirmed laboratory outbreaks, but they're becoming more frequent, right? And so that's the message we want to shift to, is like, hey, as we move forward, how can we help ensure these businesses and operators are following up with what's going on in the procedures? And we realize for you too as well that there's a lot of turnover. It's hard to keep employees and keep training them, so we're understanding of that, but really getting those procedures developed is the best start, and then monitoring them as time allows is something that we are going to work towards, helping everybody go towards that same goal. That is it for the presentation. I'll let Ralph, or if you guys have any other questions.
Actually, I do have a quick question, kind of just related to the outbreak and procedures and stuff. I'm kind of curious, like, how do you guys usually get notified? But I guess more importantly, do you have like, I've learned a little bit about this in the past, but do you have like a recommendation for a procedure if we get a call from a consumer that thinks they may have possibly got sick from our establishment?
Yeah, that's a great question. A lot of the concerns come through as a complaint, right?
Mhm.
So somebody will complain, they'll call a complaint to our department, we go investigate. These more recent ones have come through us through the epidemiology department, because once someone goes to the doctor and they get lab confirmed
Right.
results, it automatically comes to our epidemiology team. And so in that case, now it's more highlighted at a higher level, like,
Right.
hey, this is serious, you need to go check this
Sure.
location. I mean, immediately when we go there, doesn't mean it necessarily happens at that location, but our epidemiology team will reach out to multiple, if they're hitting on multiple confirmed, they're reaching out to those people that ate at different places. And so even in this investigation with restaurant A, we visited more than one facility, because people eat lots of places, right? And do they remember where they ate, what they ate? So that becomes challenging for us, like, where did they really get sick at? But what's happening with the epidemiology department is they contact those constituents that ate and get records of their receipts and how many people ate at this place that said they were sick. And so that's what led us to restaurant A. So in the beginning, we had more than restaurant A implicated based on the number of people reporting. And we will go to both, you know, so it's not like we're singling out one restaurant, but when we come for an environmental health assessment, it's something more related to something that we have been reported that it's a possibility. So in the beginning, it really is that, and that's working with the business to just figure it out, right? It's a puzzle in that moment. But in that moment we get there, we need to stop something from being served. That's what we need to do in that immediate moment, just to prevent it. And we chose to highlight that because it was a reality for people here, right? And just getting the businesses to kind of partner and make sure they really have some good procedures in place. So it does come through as complaints, or it comes through, these ones came through as confirmed lab issues.
Yeah, so we're not just gonna come out and say, we have to swab your facility because so-and-so's doctor said they have a foodborne illness. It has to, they send it to their lab, and then the state lab actually will double check the specimens as well. Yeah, so it's not just a real quick thing. It's, if we come out for an environmental assessment and say there's a potential outbreak, it's because it's really been vetted so far.
Which is good, because then that, yeah, they've been vetted. I think it's the other side where.
I have a stomach ache, or I got
Right,
diarrhea,
yeah,
right,
like,
and it's you.
Oh,
Yeah.
right. Oh, you're the last place I went and I just threw up. And it's
Yeah,
like,
right.
I just left 20 minutes ago. So.
Right, and the recommendation for that would be you can do a similar investigation as our staff would do when they come out. You can ask them, what food items did you eat? And then you can really track down those food items and what was your process for that? Who touched those food items that day? Were they ill? Were there any employees that were ill that worked recently in your facility? So you can just really focus on those food items that they had identified. I mean, most of the time it's not what you see in the toilet, you know, it's maybe a few days ago, or it could be something immediate. So just really identify what foods and then see what your processes are around those foods. Because that's the same thing, if we get the complaint, we'll come in and do the same thing.
So as a business, maybe tracking it, and people calling complaints to you directly, you know, just keeping a log, something on this day. And like that she said, going back and revisiting that process. Who prepped this today? Or how did you do it? Or, you know, just that more engagement is gonna be helpful.
Oh, absolutely.
Yeah, thank you, those are great questions.
Any other questions? So there's a little survey that chefs put together. That's the QR code to access it, but I believe you can also get a paper version if you like. Just to try to help inform them of what future topics might be of interest to you that they could present at other forums. So if you wouldn't mind just taking a moment to complete that, we appreciate it.
Thank you, everybody. If you need more time on the survey or you want to take one with you, maybe there's somebody else in your establishment that's a manager that just has some feedback, they can scan the QR code and.
One more question. So Lonnie mentioned website, Facebook, newsletter, last email, Emmanuel, I know you got the last email. Other ways, suggestions that they can promote these events? Have any? They can get the word out to others. You guys?
I just wanted to thank every health worker to keep us safe and to make our business easier and safer. Thank you very much, especially in our days.
Emmanuel, I want to say Dr. Cullen has mentioned a lot of good things about you, so thank you so much for coming. I appreciate your time.
Yeah, it's definitely, I have to admit, it's really, the food code is extensive, and knowing the food code and just the ins and outs are, you know, it can be hard, especially for, you know, staff that, you know, go through it. You know, our history is just kind of very fluid and come and go, so, and educating staff is really important and continuing that education. So, whenever any inspection comes in, everyone's always been really helpful with our questions. If something is wrong, it's very, you work with us to fix it, and move forward. So definitely feel like it's a good partnership with the health department. And every question I've ever had, I can email and I'm like, I'd ask you a question, one you've been really great about it. So, and everybody. So, thank you guys for really helping us navigate and keep our customers and the community safe. I think that's, again, you're right, the most important thing. So,
Thank you.
Any suggestions on promoting
I would say, just social, like,
I mean, it's-
and like
I'm not taking away
Instagram,
from the.
like more on Instagram and, kind of engage and, social media, I think is a big thing too. Trying to do that and, tagging some of like, hey, Young Red is gonna be at this meeting with the health department and, having to share that on our Facebook page or Instagram, if you guys wanna collaborate on something like that, we would be more than welcome to get that information out. So collaborative effort on social media, I think is a good way to do that too.
Yeah.
Thank you, everybody, for your time. We greatly appreciate you being here, hearing your message. If you know other business owners, restaurant owners, or even public that might be looking for any of the services we provide, send them our way. Again, this will be one of the first meetings. We'll send some more blasts. We hope to get our announcement out a little bit sooner, so you have more time to plan. But we appreciate your time and thank you for coming.
Thank you.